welcome any kind of help. We need to be able to pay for stem cell therapy so that he can become a much better person. Because one day if I'm gone, with after stem cell therapy, he will be able to be on his own.
We are looking for funds, well-wishers to help us fund Wasswa to take him to California for his therapy so that we can create a brighter future for him and he can be like any normal child.
Down syndrome is a genetical disorder at the point of what we call embryology, at the point of where when a woman gets pregnant, the point of the cells dividing and forming different parts of our body. We usually have 23 chromosomes within our blood, but within the Down syndrome, kids usually get 21, so they lack the 2.
I gave birth to Kevin, and the doctor told me that he's not like the normal children, and even his appearance could show that there's something wrong with him. So from that time I started getting a few books reading about children with Down syndrome, how they should be treated, and children with Down syndrome are lovable.
So children with Down syndrome delay in their speech, in their thought process, they delay in all activities, and they will need special care in terms of their management, in terms of their upbringing. They bit straining to the family members and the individuals. So for Kevin, for him is having a condition of Down syndrome.
If he finds you having a quarrel with someone and you have raised your voice, he will also raise his voice. But if you're calm, he will stay calm. If you raise his voice, he will raise his voice and even start pointing at you. But I was told that with stem cell will help him develop, and it will help him develop a few skills in him.
And if you look at Jordan is having a condition called cerebral palsy. For cerebral palsy, most of the times it looks at, or it is a condition which affects a child by determining how long and what affected during the labor. If a child or a mother takes long in labor, it affects the child oxygen supply. So whenever you hear and you're in a hospital and they tell you that the baby is getting tired, or during the pushing and the process takes long, you find that you're affecting the child in terms of the amount of oxygen they are getting on their brain. The difference between cerebral palsy is that the longer it takes for you to come up with a decision, either to do a cesarean section or go through the process of giving birth, the greater the effect.
He was delivered premature and he was taken to nursery for 3 days, and then they discharged us and we went home. But then later on I realized he had delayed speech compared to the twin sister, because they are twins. And then I took him to Butabika. That is when they diagnosed him with ASD. That is what they told me, ASD, autism. So it was a journey of learning what autism is.
Autism is usually as a result of when the child, most of the time, the child has been given birth to and has gone through the normal processes. Incidentally, something may happen.
It is so challenging, it is so costly. The schools he goes to are very expensive. The food he eats, the supplements we give him, it is so challenging that you have to strain and dry all your pockets just for Wasswa's survival.
Unfortunately, here in Uganda, we completely don't have the facilities and the professional people to do such procedures here. So it is highly recommended that the procedures are done from abroad. Abroad, they have really reached a great level of success in some of these procedures. The unfortunate part of it is that most of these procedures are highly expensive because they involve highly specialized people, and they need special tools and equipment. They need special theaters, special facilities. So this increases the cost.